I was drawn into nurse practitioner because it allows me to combine science with meaningful human connection. I have always wanted to help people feel heard, supported, and confident in their care, especially during difficult moments. My specialty, gastroenterology, helped me to allow a focus on long-term relationship with patient and a compassionate care. I enjoy patients understand their condition, manage their symptoms effectively, and improve their quality of life over time. My approach to the patient care is patient-centered and collaborative. I take time to listen, explain things clearly, and involve patients in their decision so they can feel informed and more confident in their care. I hope patients feel they've been heard, respected, and reassured, and they can live with a clear plan and confidence in their next steps. The most rewarding part of my work is seeing patients improve, whether it's a symptom relief or better understanding of their health or even improve their quality of life.